Hello and welcome. I am Dr. Ramyajit Lahiri, consultant and in charge emergency medicine, Narayana Superspeciality Hospital. And today I am with Dr. Vivek Sharma, our consultant orthopedician.
Hello.
So Dr. Vivek, today we are going to mainly talk about orthopedic related issues.
Right.
So I heard that you received your training from abroad.
Yes, I received my training from two places exactly, from Korea, Seoul, and NUH, National University Singapore Hospital. That's one of the biggest hospitals in Singapore. So it was a duration of 1 to 2 years that I was there in different times, getting trained on different issues on hip arthroplasty or hip surgeries, the knee surgeries. Knee surgeries doesn't include replacement. It included all the arthroscopic management starting from zero till you finish. It's totally taking care of the knee, the foot and ankle, and hip also. So it was a duration. It was a very nice time to learn on all those things. And main thing which I want to pressurize is, see, we all talk about knee pain, we all talk about hip pains, but they are all related, They are all related with the foot pain. The foot pain comes with the knee pain comes with the hip pains, the spine pain comes with the knee pain. So it's all related.
Okay. Do you see any sports injury also?
Yeah, I do. I do a arthroscopic surgery with the sports injury. Yeah,
also.
we have done quite the ACL reconstructions, the MPFL reconstructions, all the scopy things we have gone through. We have done the ACI implantation of the cartilage into the knee. So all these things we are doing very well out here. We have done 2 or 3 of the ankle scopies too.
Oh,
so we are into it, ankles, and very fast I'll be starting with the hip arthroscopy, which is not done anywhere in India at that point. Maybe in Mumbai, I heard Dr. Sancheti, somebody comes from abroad and doesn't goes away. So we will be doing that very soon.
Oh, great. So let's start about our foot pain. So can you just tell us about something regarding this foot pain and all?
See, the foot pain, if we call foot pain, 99% or maybe 90% comes with your biomechanics. It means the way we place our foot, the way we walk, the shoe wear is very important. The shoe wear is very important. I persist, shoe wear is so important that if you are wearing a wrong shoe, even causes pain. One. Second thing that is very common, which everybody knows, is a plantar fasciitis. We have a plantar fascia down the sole, a thick fascia that gets inflamed. That is one of the causes of foot pain. Then you have flat feet.
That is mainly because of the shoe.
I told you that the posture,
walking.
And few people do have these problems, not with the shoe, because of the congenital problem, or maybe they have a very flat foot or a flat arch. When you place a foot on the ground, you form an arch with the floor. Exactly, you form an arch.
Yes.
And you'll see few people who don't have an arch, they have a flat foot. Slowly their foot tends to go out, and then you develop that foot pain leading to the knee pain. So that has been approved in the literature. Even the people who are having flat foot from age maybe 2 or 3, they tend to develop arthritis of knee very soon. There's a research on this going on. This is proved research, and this flat foot causes lot of compression and force on the medial part of the knee, and causes the medial part of the knee to go bad very soon in life.
Okay, just one question, that what is your advice for this kind of patients? Means those who are having this foot pain, or they have this flat arch. For them, what kind of shoe actually they are supposed to wear?
There are few things. If you have a flat arch in beginning, try to modify your shoe with a medial arch raise. If you have a metatarsal sagging, you need a metatarsal bar. If you have a calcaneal spur, you need a calcaneal soft sole.
Do we have this kind of shoes available in India?
Shoes are not important. You have a silicone insoles that are made by all big companies in India.
Good.
Or abroad, whatever this is present in the online, Amazon, everywhere you get these soles, silicone soles, with a metatarsal bar, with a middle arch raise, with a lateral arch raise, you get everything. And on the online mart or in the shops, renowned shops in India. So you can get those with exercises. There are a lot of exercises. Get your physiotherapists on. Try doing exercises. There are various modes of exercise to be done that will help you to delay your arthritis in future. The knee arthritis that is going to come up very soon.
Okay. So you are talking about all those pain can lead to your knee problem.
Yes, so these flat foot people, exactly Dr. Lahiri, I told you, these people, when they grow up, the march is flat, their foot tends to go out. So when you are going out, the middle compartment of the knee biomechanically, there's a lot of pressure on the middle side as well as the hip and spine. So the patient comes to me at the very young age too. It's not arthritis that is related to very old age nowadays. At the age of 32, I have seen people coming with bad knees because they had flat foot and the whole compartment is gone. So then the query comes, what to do at that age, 37? Would I replace a knee? Would I do some other procedure as called high tibial osteotomy or PF or something like to give her something so that she can continue or he can continue. So that is important. A better quality of life is important. So this foot problem is very important.
And especially when in young age you are getting so many patients, so that is actually important because for them the life expectancy is
quite much. We all know that whatever you do, we go for, if you think of a knee replacement, obviously the life is 20-30 years with the plastic that is inside. The metal has a long life, maybe 1,000 years, but the plastic inside has 22 to 30 years. So we ideally try to do nowadays, the best stage of doing a knee replacement is 50 to 80 years. So tell them, okay, 50 to 80 years the time when the knees are gone bad, you go. If you really require a revision after 20 years, you can go for it. Otherwise, very young age, we try to avoid doing a replacement. Unless it's a rheumatoid or other things coming up with the angst totally gone knees, you can't do anything, then you have to replace.
So what are the main complaints actually these people are?
See, the patient complains of what? Or the knee pain or?
Yeah, knee.
See, the patient usually comes with muscle weakness. The first thing, see, when the patient comes and says that they have pain in the calf, they have pain in the thigh, they have pain around the knee joint, that is the first symptom to say that yes, your knee is now turning into a bad knee in future.
So this is one of the highlighted point till now, because we always think a knee pain will be only concentrated around the knee, but it can actually manifest even in the thigh region, even in the cuff region,
even in the back. People come with the back pain, where the SI joints are involved, sacroiliatis joints.
Exactly.
People come with the sacroilitis.
So even with this problem, it is sometimes always better to evaluate.
True. Evaluation and saving your thing will give you a lot of in future. Maybe they'll buy time not to get into surgical intervention very soon. They'll give you some time. Once you are too bad, now somebody comes in and says, what is the right age of doing, or what are the symptoms that I would go for a knee replacement? So the two things which I would say is a pain that hampers your daily quality of life. You cannot walk for 10 steps, or you cannot sit, you cannot do your work, or you're sitting too long and you get up with a lot of problem, or you are carrying a walking stick or a walking aid to walk few steps, and deformity. Now you see people walking with a battling gait with a curved knee.
Exactly.
Is the time, is the right time to go for knee replacement. Don't delay, because then your back goes. And then once the back spine is involved, you have a lot of procedures in spine to coming up.
Yeah, ultimately that knee pain, because to stabilize the knee, your back is coming into play.
True.
So that is also getting...
So that also goes bad and worsens up with all discitis and all operative intervention in the future. So that's the right time is to save, and nowadays we have really good knees coming up, real good surgeons coming up to do and give very good amount of a good knee for future.
Oh, great. Now, just tell me, if somebody, having a knee problem and willing to go for a surgery, what generally the stay and all those things?
So the things, if somebody wants a knee surgery, the first thing I follow typically what I followed in my Singapore training periods. The patient comes 3 weeks before, and I get all investigations done, excluding any infection in the teeth, urine and chest. This is first thing, and other tests.
That is OPD basis.
OPD basis.
So no need to admit.
No need to admit. So you get all those things done. You come to me. I see all reports are okay. I get my cardiac checkup.
How many days? After how many days they are supposed to come?
3 weeks before the surgery, this is to be done.
Okay.
So once I see the reports, I send the patient to my cardiac evaluation to our renowned cardiologist. Once the cardiologist says, okay, the echo and everything is fine, we send the patient for a pre-anesthetic checkup. That means every patient who's going for a replacement surgery would go for anesthesia. So anesthetists will require anesthetic checkup that person is quantitatively fit for surgery or not. So they give a tick mark and they make a brochure and they say, okay, the checklist is okay and she can go. Then they come back and I give them time for surgery. The 2 dates are given. If one knee is involved, we have a 6 days stay in the hospital. If 2 knees are involved, I do on a 2nd and a 5th day. For 10 days, the stay is 10 days in the hospital. After 6th or 10th day, the patient walks 10 to 12 steps, can sit quietly, comfortably on the commode, toilet training is done here, and can walk and actually walk and go back home.
Okay, great.
And that's what the patient has given me the feedback, and you would see few videos of patients are coming up we had a video with these people, and they have done very well actually.
Great. Achha, just tell me one thing. Okay, once you finish the OT and patients start, walking and all, so post that, rehabilitation is a
Very much.
important.
See, it's important. Why 1 month of rehab is very important, because everybody knows that we enter the knee by cutting the muscles on a tendon junction. So that's the way to enter into the knee. So those part becomes weak. Quadriceps and all become weak. We have to suture it back. To bring those part back and keep your thing mobile in place, you really need a 1 month of generalized, very good rehab. If you are very well with your rehab, you do wonders.
What
You'll be
about
smiling.
our rehab in Narayana?
Narayana rehab is too good. We have trained 5 to 10 physiotherapists working out here with 2 or 3 senior people are taking care of the knee patients, and we have so much channelized things. As soon as the patient goes for the surgery, the physiotherapist and the other people are already informed. So they know their protocol, the second day, first day protocol, what to do in the physiotherapy, dressing when to be done, when the patient goes to ICU, when they come back. It's all channelized. So we don't have a problem here doing things. The things are so much analyzed, till the patient goes out of the hospital, they don't have any problem.
Great. So even after going from here to their home,
we take care of that. I make things possible that the physiotherapist here talks to somebody, and they send the physiotherapist at the home of the person for the physiotherapy 1 week. And every third day, the physiotherapist sends me a WhatsApp picture on my WhatsApp to see how the prognosis is going for the patient.
Okay, great. So you have a control even after
the
your
surgery. I
also?
don't leave till 3 months. I am with the patient to see what everything is okay or not.
Great, great. Actually, this is actually required, because doing the surgery is not the only part. It is
It's
carry forward.
Carry forward. How much better results can you give? How much better the patient
Yes.
can do after that
Yes,
functioning?
the quality of life, what you are
Yes.
providing to the
It's
patient
totally
is
a
very
quality
important.
of life improvement, and I see the quality has to be improved. The patient should smile after 3 months. Yes, I'm doing very well.
Yes, it's actually that actually gives you a better feeling.
And it gives your doctor, as we doctors, it gives you a
that
smile
is-
on our face and the patient smiles.
Yes,
Right.
that is the ultimate,
True.
thing for us. Okay, so today we are finishing our talk on knee as of now. Thank you very much.
Thank you.
Hope
Thank
have
you so much.
enjoyed it.